Good morning, Jim Hunt, your Acting Director of Health Services. And if we could have the PowerPoint, please.
They're working on bringing that up. Can you please change the PowerPoint?
Good morning, Jim.
Good morning. It's a pleasure to be here, largely with good news. We've seen our rates of transmission. Most of the factors that we're seeing are absolutely positive. And I'll show you in a minute. Hey, there we go. Thank you. So our test positivity rate, now these are 7-day averages, and they're updated every week. So they're a little behind, and we got new information this morning, and I will give that to you in just a moment. But the trend is what's important. It's going down and going down significantly. That is just very good news. Likewise, the number of positive cases, we're still at a level that's close to what our peak was in August, but we're heading in the right direction. So, I mean, the message here is we're still in widespread transmission, and we still have to be cautious, but things are looking very good. Hospitalized patients going down dramatically. Number of ICU beds going up that are available. And total deaths. Of course, yesterday we marked 500,000 deaths in this country, more than all the deaths in World War II from Americans, 9 times the ones that we had in Vietnam. Truly a sobering statistic. What I wanted to show here, these are the factors that we're judged by for going down to the red tier. And as of yesterday, these were the numbers. Today we got, as Dr. Kasuri mentioned, the updated numbers, and our cases per 100,000 right now are at 15.3. And Dr. Kasuri and I agree that I think next Tuesday we'll be back saying we're below 14.
Is that the state or the county's
This is
number?
county.
Okay.
This is our county specific.
Madam Chair?
Yes, sir.
May I ask a question?
Supervisor Cerna.
Thank you. Jim, so on this slide here, it's very important, obviously, to understand the statement at the bottom about maintaining the standard for 2 weeks. But there are different parameters, or different standards here. So what happens if your cases per 100,000 hit the mark, but your equity positivity rate doesn't? When does the clock start, I guess is my question, based on what criteria?
When we meet all of the criteria.
Okay, so all 3 have to be?
Yes.
Okay, got it.
So I believe that we'll hit 14, which allows the youth sports next week. We're at 18.7 last week. We're down to 15.3. That's a dramatic drop. So absent any surge, I think we're looking good for next week. Our overall positivity rate is down to 5.4% today. And the equity positivity rate is 8.2. So we're just right there on the border. So I'm thinking next week we will be looking very good.
I just want to point out that what Jim Hunt is showing is what's on the state webpage for the blueprint, and that is what is used to be able to help us to advance to another tier. Our dashboard, and that's a question that we've been asked a lot, is why are the numbers different? The blueprint has a 7-day lag, and it does a 7-day average. So this is showing you, if you were to look at our dashboard, this is where we were at a week or 2 ago. But with our dashboard, we update the case rate daily, and we use a 3-day average, and that helps with knowing where the trend is going. So it, especially like for schools that have to prepare once we get to the red tier, it's very good for them to say, okay, we've hit the mark. That means that in the next 2 weeks, we're probably going to meet all the criteria for the red tier according to the blueprint dashboard. So that's the difference. I know sometimes it looks confusing, but we do it so that we can give people an idea of the trend and the direction that we're going in.
Yeah.
And for the benefit of the public, the equity positive rate is, can you explain it?
The positivity rate is for the county in total. the equity positivity rate is for those neighborhoods that we consider vulnerable, that have various social, economic factors that make them much more vulnerable to transmission of the disease. And so we need to get that down as well. And of course, this is a big part of the emphasis to reach those vulnerable communities with immunizations, so we can bring down that rate throughout the county, and especially those vulnerable communities.
Thank you.
Yes. This is a chart right off of our departmental website, the Public Health Dashboard. And I just wanted to use this to show you the distribution of cases by ages, so that you can see from ages 20 through 60, that's where the vast majority of cases are. But this chart shows you the distribution of deaths and how dramatically that is skewed towards the older population. This is why there's been so much emphasis placed on the 75 plus group and the 65 plus group, is to reduce the mortality. This is another chart off of our departmental website. And by the way, we have some wonderful people, our epidemiologists and all those folks down in public health that put together our dashboard, just do a great job. But this shows you the cases by ethnicity. And what's dramatic here is how the white population has significantly less cases, and all the other ethnic groups are higher. But what's counterintuitive is if you look at deaths, the white population is far higher. And I haven't seen studies of this, but my sense is that the white population in general is wealthier, live in neighborhoods that houses are spread apart, they're not crammed into apartments, and they have access to better health care. So that's why the deaths, in my opinion, are much less for the white population. If you look at the Latino, the Hispanic population, theirs is lower. I would bet that's because they have younger families with more children, less likely to die from the disease.
I'm not sure I understand. You said the white population is more wealthy, but they have more deaths.
I'm sorry.
Because
they're more wealthy, because they have better health care, they're less likely to die from the disease.
But they have the most, but you're saying they have less deaths by when you compare it with by population?
I can explain that. The reason is the increase in deaths by age.
Right.
And if you were to look at ours, that you see that about 80% of our cases are over the age of deaths are over the age of 65, and predominantly Caucasian. And a lot of that is because of the deaths in the long-term care facilities. About 50% of our deaths were in long-term care facilities.
Oh, okay. Supervisor Cerna.
Thank you. I want to understand what the muted percentages are.
I'm sorry.
So
the muted percentages are from the chart. That is the percentage that you see in that pie chart. The one on the right is the general population. So the general population of whites in the county is
okay.
45%, but 51% of the deaths. I'm sorry.
Gotcha.
And the other ethnic groups, Asian, Black, Native Hawaiians, and American Indian, are all higher than you expect. The one that's really troubling is the Native Hawaiians and Pacific Islanders, where their ratio of mortality is twice what you'd expect from their population. At any rate, this gives us the impetus to get out there to those vulnerable communities and populations to get them immunized as quickly as possible. This is where we are now. We're in phase 1B. We started with the educators and child care providers on Sunday. You'll notice under phase 1C, the second box is for persons aged 16 to 64 with the high-risk medical conditions and disabilities. With the governor's pronouncement, those folks on March 15th will be moving over into phase 1B and will be added to that group for immunization sooner than they otherwise would have. This one just displays the vaccinations, the vaccines that we have received, both from Pfizer and Moderna. And it's been a little inconsistent, but from the week of January 25th through last week, it was increasingly positive and going up, as you would expect as the state gets more vaccine. This current week, we're only receiving 14,850 doses, quite a bit less than we got last week. And Dr. Kasiri and I have both been in contact with the State Department of Public Health at the highest levels, trying to get some satisfaction and get those doses back up. This is showing our first dose allocations in comparison to other counties, and it's just all across the board. The state dramatically changed the allocation methodology. And even though the state received 22% more vaccine, Sacramento County received 18% less. We believe that a big part of this is their data system. The vaccinations that we administer aren't all being recorded, and that's been the case in many counties, and probably the case in Alameda and Contra Costa. They just say they are getting a lower vaccine allocation as well.
Excuse me, Jim. We have several people punched up. Supervisor Natoli.
Yeah, I appreciate it as you were explaining it. Because part of what I was going to say is, so you're trying to get a satisfactory explanation. Again, I'm not so sure there's a satisfactory explanation for at least what you've described thus far. And if their data system is such that it's not proper recording, I mean, again, as we talked about in previous item this morning, I mean, again, this board, is certainly working, you and Dr. Kasiri and others are the voice for this county. If we're getting now, in this current allocation, approaching 20% less, we did have 20% less need. And granted, there's a limited number of vaccines coming into the state overall. But if there's a flaw in their data, then I think it's incumbent upon them to address that. I don't mean you. I mean, obviously, you. But if we need to advocate at this level that there be some, adjustment, equitable adjustment, if in fact, again, not looking to point blame, but if there's a lag or there's some other, shortcoming in the data, then don't penalize the people of this county. And, as we discussed this earlier this morning, and, we'll probably get into this a little deeper. I mean, there's people are feeling the effects of the pandemic in so many ways, and, obviously losing loved ones, but the here and now. And if we're getting 3,200 less vaccines this week, that's 3,200 less people that, as you're beginning to move through the tiers and trying to get teachers inoculated, complete those that were over 75, the higher risk categories, or first responders and so forth, it just delays us as as communities in the county, and certainly all the other things that come into play here. And I guess, Jim and Dr. Kasiri, if there's something we can do at our level to advocate this without interrupting any work that you're doing or making it more difficult at your level, to me, this is key. And so maybe there are adjustments in the works, and so maybe you're getting more satisfaction to the questions being asked. But if not,
let me tell you where we are.
Okay, good.
We have made this known to the director at the state level and his staff. What we were told yesterday is that the State Department of Public Health will no longer have a role in creating the allocations. That gets shifted over to Blue Shield. Dr. Kasiri and I have a Zoom call with Blue Shield this week, where we will press these issues and others that I'll show you in a minute.
Okay.
But you're right, this is just unacceptable. And that's what we have said to them. And we have pointed out the flaws in their methodology. We have pointed out the inequities. And we've been told, gee, we can't do anything about it now. It's Blue Shield's problem.
Well, for the state to wash their hands of it and say it's all of our problem. We're, as Californians, but certainly as Sacramentans, and to say it's, now it's Blue Shield because we just gave them the administration of the program. That's a pretty lame way to approach it.
We agree, and we share your frustration, believe me.
And then on top of that, I mean, if you consider of the 58 counties in the state, we're the ones that has the largest unincorporated population as a percentage of total population. Makes absolutely no sense.
We're getting a lot of feedback from our constituents about it too.
Well, as we should. I mean, because it affects everything we talk about. Certainly the safety and the what the vaccine's supposed to achieve, but all the other things that are tied to that.
Yes, yes.
Wow. Okay.
Okay.
Thank you, Supervisor Natoli. Supervisor Desmond.
Well, I'll just add my voice to that as well. That's extremely frustrating and just counterintuitive. You look at those numbers that you just had up there, it doesn't make any sense at all. And is the state saying that they're making it up somehow in Sacramento County with direct state allocations to make up for this? I'm just curious.
So there are a couple of factors. One of the things they've told us is that they changed the algorithm that they're using. Before, they were basing it on the population in Phase 1A and healthcare workers, but now they have changed it, and the focus is on Phase 1B Tier 1, which includes agriculture. And I think if you can see that places like Fresno and Los Angeles got a marked increase. The other thing also that we've been told is that Kaiser is going to play a larger role. And I think before they were getting about the same as the other healthcare, or they call them the multiple county entities or large health systems. But now they are getting a much larger percentage. I think it's 20%.
Yes, they've gone from a 10% of the statewide total to 20%, which on its face is reasonable because they cover 24% of the state's population. But as you can see, the state received 140,000 more doses, and Kaiser got over 60. There's like 78,000 doses that could be spread around to other counties. And I go back to the days when Bruce Wagstaff and I worked with CWDA on statewide allocations for welfare money, and one of the principles we always had was hold harmless. If you got more money, you're putting it into the stream, you're changing the methodology, that's fine, but hold counties harmless. Don't take money away from them.
Right.
Well, in this case, we say the same thing, and we requested that we be held harmless. What we were told is that we could probably expect the same number of doses next week that we're getting this week, the 14,850 number. But we'll have our discussion with Blue Shield and see where we go from there.
Well, and I also want to echo what Supervisor Natoli said. I mean, I think that we could deliver a joint message to our legislative delegation here in Sacramento County to advocate for more doses locally administered by Department of Public Health. I mean, especially since it seems like really hitting your stride recently and how effective some of the vaccine clinics have been. And I know we'll be having more of a discussion about that. But I just think we have great advocates here at the state legislature who represent us, and we need to be communicating with them very directly, very clearly, and get all the other municipalities involved in that effort. So.
The last thing also is that we're being told that they're looking at how many doses we're administering. And that's where the concern about the data comes in, because, and I actually listed all of the data problems that we're having and gave the list to Jim Hunt, because they have about 4 systems that we have to enter data into, and at each of those systems there are issues. And so we're trying to work with the state on them, but it's taking a long time. There's no ETA on being able to solve them, and yet at the same time, when Blue Shield comes on, we're going to be judged by how many doses we're getting out.
Right. Flo, could we go from the PowerPoint to the overhead camera?
Supervisor Cerna.
Great, thank you. So I would certainly be willing to put my name to any written correspondence along with my colleagues, if that's something that the chair and working with Dr. Kasuri and Mr. Hunt are interested in, that communicates either directly to our legislative contingent or even the governor's office that expresses this concern over the lack of vaccination capacity, because I think it's certainly something that is in real time resonating with a number of the people that we hear from that are concerned about lack of access. And to that point, as Supervisor Tully noted, we are hearing from our constituents, and during the briefing I had with Dr. Kasuri yesterday, because I'm sure all five of us have our own stories about the number of phone calls or emails or text messages or comments on social media about the lack of access. It's becoming increasingly difficult to manage those responses to those constituent concerns. And so what I've suggested is that through our Department of Health, Public Health, that we devise a FAQ of some sort that we can easily, the five of us and our respective staffs can easily use to communicate back to our concerned constituents the moving parts, the dynamics, the dynamism, if you will, of what's at play relative to who's responsible for what to get vaccinations in arms, because I think there's a lot of misinformation too out there, but that has everything to do with the fact that we can do a better job of communicating what it is that we do have under our control and what it is we do not have under our control. Doesn't mean that we're excusing any of it. It just means that I think an informed public at this point is going to be perhaps a more understanding public, and that way we don't have to, spend as much time and energy tailoring our responses to various groups or individuals that are filling our inboxes as we speak. So I look forward to seeing that FAQ hopefully perhaps by the end of the week or by the end of next week. Okay.
Yes.
Good. Thank you.
Thank you, Supervisor Sir. And I too would be, if the board wants to put together a letter to the state, I don't know if that would help, but I think that's a great idea for us as a board to reach out and inquire and ask for help with it. Would you
Sure.
want to put something together for us?
Mm-hmm.
Okay, thank you.
This chart is right off of our public health website. And what I really wanted to demonstrate here is I have a total administered, and these are first and second doses. We have administered almost 220,000, but only 173,000 have gone to Sacramento County residents. So what happens is we're an employment center, and the vaccination priorities have been based on occupations. So when folks in those occupations commute from Roseville, West Sacramento, El Dorado Hills, and work in Sacramento County, they get vaccinated here.
Supervisor Cerna.
Thank you. So, Jim, does that mean that the converse is also true in Placer County? So if someone lives in Sacramento County, but they
Yes.
work in Placer County?
Yes.
So, so this is this is not a net number, so to speak, because you're not taking into account the number of our residents
That's
that are
true.
getting.
I'm glad you brought that up.
Yeah.
So thinking that might be the case, I took a look at our surrounding counties that have the highest level of commuters. And if you just look at the doses per 100,000, ours is the least of all the surrounding counties, which says that we are vaccinating far more of theirs than they are of ours. What happens is that they are able to more quickly go through the tiers, able to vaccinate teachers before we were, ag workers, and then our residents, your constituents, talk to their peers in other counties, and the other counties say, hey, we're getting vaccinated, why aren't you? Well, this is one of the reasons why, our low vaccination rate, because of reduced allocations and because we're vaccinating others in other counties. So just one more slide here, and then I'll let Dr. Kasuri have
Could
our
you display
time.
that on the screens, please? I was just asking the clerk, could you display it on some? Is it up?
I'm sorry?
I was trying to get it displayed. I don't have it on my screen.
Oh, no, I'm sorry. These are slides that I've added afterwards. They're not.
Okay, now I've got it. Okay.
Okay.
Thanks. Thank you.
So in phase 1B, tier 1, this is the population in each of those categories. That is a lot of people. And then on top of that, if you add in the 20% that we use to vaccinate other counties' residents, you can see what a challenge we have to get out of the tier 1 and down to tier 2, where, for instance, our airport workers would be. This is a huge number of folks to vaccinate, and it's going to take us weeks, if not months.
Could you display the side-by-side, Jim, the one you just showed a moment ago, so I can get the numbers, if you wouldn't mind? I don't know how they fit there together. So we've administered 252,000.
Now, when we say we, this includes the multi-county entities and the skilled nursing facility. So this is the whole ball of wax, and it is first and second doses. But what's critical here is when you look at the equity between counties, we fall short. We have fewer cases, fewer people who have received doses in Sacramento County than our surrounding counties.
Madam Chair, guys, I had a question. So, for example, when we're, moving into the tiers that would vaccinate teachers, and you still haven't completed the 75 and older, or certainly 65 and older, and you look at the numbers you just displayed in the other chart, and then and then you roll in first and second doses. Again, I'm sure there's ways to split the numbers and split them out, but wow. That leaves us quite a bit. And then those in food and agriculture, 94,000.
Yes. We haven't started them yet.
And yet we get shorted because there are other counties that may have more predominant agriculture, but that's still nearly 100,000 people in this county are related to agriculture.
Well, that's our grocery workers as well as
sure, yeah, okay, commercial grocery workers. So, and so with the 443, you've got to get most of those addressed before you move. What allows you to move to the next tier?
Dr. Kazari?
There's no hard deadline on when to move, so we just look at how many appointments we have, and if we think that we've vaccinated at least a large percentage of the tier that we're currently vaccinating, then we move on to the next one. And I also want to point out that that's the reason why, even though the state said that we could vaccinate everybody in phase 1B tier 1, we did it a little differently. We started off with emergency responders and those over 65, and then added education and childcare. And then in mid-March, we will be able to add the food and agriculture, because if we try to do everyone at the same time, you would probably be getting a lot more complaints with people not being able to get appointments. So this was our way of trying to deal with it so that we could provide as many appointments as we could for each of the tiers. I mean, each of the sections.
Okay. Did you complete your questions, Supervisor Natoli?
Yeah, I didn't punch out. That was just why you had the charts up. I'm sorry. So I think
Okay.
Mr. Kennedy's punched up. So I did.
Supervisor Kennedy.
Thank you very much. I might ask you to repeat some of this just because it's confusing. So you said the whole ball of wax, that was 2 slides ago.
Supervisor Kennedy, could you move that mic a little bit closer to your mouth, please? Thank you.
Chance.
Sorry about that. I was having equal trouble hearing
Much
you.
better.
So you said that the 2 slides ago, that was the whole ball of wax. So that's including the nursing facilities, which is CVS, Walgreens. That's the healthcare systems, and the healthcare systems come from the state, and the others come from the feds, and that's including everybody. No,
Yes.
not that one. I think the one before that, wasn't it?
Okay. That'd be on the PowerPoint.
Oh, okay. All right. Well, anyway, so that slide, you said that was everybody. That's the totality of it. It's not, we're not differentiating between federal, state, our community.
This is a slide that does have the totality.
Yeah. Okay.
This should be everything.
Okay. And how are the teachers are getting theirs directly from the districts? Is that come out? Well, okay.
I can explain.
Yes.
So when I mentioned that we added the teachers to the list of those that could be vaccinated, we have several sites where they can get vaccinated. And actually, I know that you have all requested that we give you the list on a weekly basis, because we make up the appointments on a weekly basis once we know how many doses we're getting. So I'll go over that real quickly. So over the last week, EMS, and also to point out that in addition to what we're doing, our partners are also helping as well. So EMS.
I'm sorry, Dr. Kassiri. If we can be as crystal clear as possible and not use words like our partners and.
Yes, I'm going to explain who the
define what that
partners are.
means. Thank you.
Yes, I'm going to explain who the partners are. So EMS is helping us with vaccinations, and they did a clinic at Folsom High on Saturday and vaccinated 1,170. So these are clinics are open to the public. They are on the school sites, so that we can make it as easy as possible for teachers to get to these sites. But we also do keep a certain percentage of appointments available for those 65 plus, but majority are teachers. Then Urgent Care Now did a clinic at Jesuit on Sunday and vaccinated about 2,000. UC Davis and Dignity working together, they did clinics at Sac City Unified, did 1,558, and San Juan Unified did 2,258. And then Cal Expo is also a site that we use for the occupation sectors. We did last week 3,828, and just to let you know that Cal Expo is open on a daily basis, but last week, because of the shipment issues, we weren't able to get to our target. We're hoping to actually be able to do about 7,000 a week. So as you saw from the chart that Jim Hunt showed, there was a dip because of the lack of shipment, but we'll make that up. So we've at Cal Expo, we've done a total of 17,219 since we started. And then UC Davis and Dignity also did a clinic at Del Campo, and that was 2,260. In addition to that, upcoming, because I know the next question will be, well, how about these other districts, with some of the questions we've been hearing. We are working again with the partners that I've mentioned, UC Davis, Dignity, and EMS mainly, to be able to have these pop-up clinics at the different school sites. So we have them planned for the Galt area as well as Twin Rivers. I don't have those dates yet, because we'll get them once we know the number of doses we're getting. And then maybe if I can finish off, in addition to all of that, we are also working with Dignity and UC Davis and some of the FQHCs to start clinics in the underserved communities. These will be much smaller. If you recall the numbers I've given you, and we'll type this up and give it to you, the clinics that they're doing are in the thousands, but we want to do much smaller ones, like 50 to 150 in some of the underserved communities. These will be walk-in clinics. We'll have some of the community-based agencies available to be able to help people register. We did a pilot at La Familia and did 150, and I heard a lot of good things about it. We also are planning to do one with native Hawaiian Pacific Islanders. As Jim had pointed out, they've been hit really hard, so we're planning to do one in that community as well. I mentioned that mid-March we will be able to start having appointments for food and agriculture. And so we've been working with some of the business owners in those sectors to start planning how that will look like. Some of them will be able to use the sites that we already have. But for those that work in the field, we're probably going to have pop-up clinics at some of those field sites. So we're still working out those details. And lastly, with the jail also, we've been giving you updates on the cases that we're getting there. And we made a decision that we are going to start vaccinating all of the inmates. So working with jail health on that as well.
Okay, a couple things. first, for example, I heard that there was a clinic at Sac City College recently.
Yes.
Who would that be?
That was Dignity and UC Davis. We do give them some vaccines, so probably when they're advertising, they'll say in collaboration, Dignity, UC Davis, and Public Health. But it's really mainly Dignity and UC Davis that are doing those clinics.
Okay, and I'm going to, again, you and I have gone back and forth in texting, but I'm going to, for the record, say that when we do expand in South Sacramento, I hope that we will continue to take into strong consideration the zip codes when we do this.
Yes.
And that puts Pinnell Center, I think, as an ideal location, and the city has reached out and said that they will be completely cooperative with that.
Yes.
The other thing I will say is that with a few minor, outliers, I have heard from a number of sources how when they there's a lot of confusion about this. We're all confused, and I get that. I understand it's government at its best being as confusing as we can be, starting at the top. But I have heard nothing but great things as far as when people go to the sites, when they're getting vaccinated, these things are running very, very smoothly, and please pass that back to those that are on the ground.
Sure, thank you.
Okay.
Is that it?
That's it.
Okay, Supervisor Natoli.
Yeah, I had a couple of questions, and I wanted to put something in the record. As relates to our food and meal assistance, and again, I know that we've gotten, in the report that Dr. Kasseri and Jim bring forward, we get the accounting going back all the way to November, fast forwarding to within the last couple of weeks. Each of us either has representatives or sit on the Area 4 Agency on Aging, and I know that on the last call, certainly they've appreciated the cooperation with Department of Human Assistance and certainly Bruce, your work and others in that regard. But we only funded that through the end of this month, and so where are we? We got the second tranche of money, and how are we communicating that? Okay, so anyway.
I was just waiting to see if they were going to answer.
Oh, okay.
We are looking at different funding options, Supervisor, to continue that program. We're hoping we can find a way to perhaps continue it through the rest of the fiscal year. You recall in the last update, we were advised that we're getting $59 million more in the way of funding. We haven't gotten all the guidance on how that funding can be used, but Jim and I have been talking along with Michelle Cajeas and her staff about how we might be able to utilize this to keep that program going. We've had great results, and that's what we'd like to do.
Well, I guess what I'm a little worried about, though, is that we only funded it through end of this month. As it was described in brief, they obviously were notifying recipients of those that were vulnerable, many of them, very elderly, and a lot of them been in isolation situations for a long time, months and months. So in order to avoid that, recognizing that, we have to be funding certain here, is there some ability to bridge that when we figure it out? And if so, are we telling Area 4 about that? Because I think, and the vendors, obviously, that are delivering the meals, and I've heard very good things to Patrick's compliments about the staff administering vaccines. I mean, that program has probably worked some miracles along with, a lot of other efforts in this community, and I want to acknowledge that. But I'm concerned that, we're only funded through Sunday of this of this week.
So DCFAS is talking to the AAOA this week about how they can look at this in anticipation of the possibility of additional funding, and so they're doing their planning accordingly. So we're looking for ways that they don't have to phase it out, and they can look for ways to keep it going.
Well, if I may, one of the things that our department is very good at is retroactive contracts.
Okay.
And I could go out on a limb and say, between the general fund savings and the new funding, one way or the other, we can keep this open until we come back with a plan for the $59 million. And I see nodded heads, so I'll go out on that limb.
Yeah. Well, and I was going to offer one suggestion. I know that we have, our county has stood up as a backdrop when, in years past, when Area 4, because of federal or state delays in their funding stream, we stood behind, we put a $600,000 down. It's not a line of credit, but it's an arrangement And I think we've actually budgeted for that. I know Britt's familiar with it, maybe others here as well. So if we didn't have the opportunity you talked about, I was thinking to myself, we already had this arrangement where so Area 4 wouldn't be out the money, and ever how you get to it, but I was going to offer that as a suggestion that where we've stood up behind that, and that, that's for a brief period of time when there was a need to bridge some gaps in the funding for Area 4. So, and they've been a good partner, and we've been a good partner as well. So, ever how we get there, I just want to be sure that this Sunday, the notices of conclusion or termination are issued, and the vendors are, left. You can't bring the meals on Monday because you guys didn't figure that out. So.
Now, we're in touch with AAOA this week, Supervisor, and together with what Jim just said, it's our hope that we can continue this program, we hope, throughout the rest of the fiscal year.
Okay. All right. Well, very good. So you'll keep us updated on that. Maybe somebody can just give us a status, a brief email or something before the end of the week so we kind of know how that worked out. Okay. One other thing I wanted to touch on, and I kind of alluded to this in the discussion on about the youth sports, and we all, as Supervisor Cerna and others have said, have been receiving a lot of input about, not just, who gets vaccinated, how do we get signed up, but I think the impacts of obviously being out of school, and certainly this board doesn't make determinations about that, but we're certainly in the driver's seat as it relates to, how we can best administer the vaccines that are given to us. And I kind of feel important to make just read from a couple statements here, because as I hear that, we're making an appeal to the state because we're getting less vaccines, and that they, the offer, well, now that's in somebody else's bailiwick, and you county got to go out there and deal with 4 different data sets and blah, blah, blah. The reality is that we have people, as we all know, and I would trust they know as well, that are being tremendously impacted by, certainly all the aspects of the pandemic. But I had a letter, and I think my colleagues may have gotten as well, from the mayor of Galt, Sean Farmer, and I just wanted to read a brief portion of the letter, because I think it reflects, some of the things that it goes to. Again, excuse me. I got to get better at talking through a mask. At any rate, I think it reflects some of the impacts that go beyond the pandemic, that may be lifelong in that respect. And so he shared a story from what he described as a longtime family friend. He said both her daughter and her son had been great students in the past, achieving straight A's, as well as being very involved socially in sports and other school functions. Over the last year, both of her children now are failing in their classes. Her daughter specifically has lost all interest in school, has lost contact with her friends, and is demonstrating all the classic symptoms of depression. She doesn't eat like she used to, has lost interest in hobbies, doesn't even like to leave her room any longer. Her son has also lost interest in sports as well as his schoolwork. And what he says, I think, this can be repeated. Thanks again for the water flow. Repeated time and time again, because we've all heard these stories, and we've heard some this morning, is that, they're really heartbreaking, and that, in addition to that, he notes that a local first responder in Galt recently told him that he's responded to more suicide attempts over the last year than throughout his entire career as a paramedic. And he said the very shocking part of this was that in the conversation was when he told me that most of those are for people that are under the age of 18. And another, and I think we may have received this as well, but one other parent, again, amongst many who've written me, used a pretty compelling visual as she described it. And so I'm just going to take one more moment here and kind of take us into this story. I trust that it reflects a true situation. She says a young teenager, wants nothing more than just be a teenager. She gets up in the morning, being the oldest in the home, cooks breakfast for her siblings, wakes them up, tries to get them to cooperate and come to breakfast, and then get them ready for school, distance learning. So they are younger siblings who react the way younger siblings do with an older sibling. By the time she gets them settled, she can finally turn to her own classes. Midway between her classes, she can see that her siblings are not working on their schoolwork, so she turns off her camera, leaves her classroom, so to speak, and tries to get them back on track. Meanwhile, she misses an important part of her lesson, and in leaving her teacher wondering why she turned off her camera. She returns but realizes she is lost in the discussion and too embarrassed to ask a question, and may even be admonished for turning off her camera. The teacher can't see the worry and insecurity on her face or feel her energy because she is a small box on a screen along with all of her fellow students. This young lady starts to worry. She's going to disappoint her parents and teachers. She's been a good student. Her stomach turns. She tries to once again settle her siblings before she makes them lunch. And feeling exhausted, she wants nothing more to be a regular teenager, hanging out and laughing with her friends, gaining the confidence that comes through achieving in the classroom and performing well in school. And so she starts not eating and constantly worrying. Her heart grows more heavy by the day. And I use this as an example because I've talked to parents, again, very close friends and associates who have youngsters who are suffering from depression, they have suicidal tendencies in some cases. They're lost when it comes to school. I had it described to me just over the weekend that the youngster, 13, going to be 14, has retreated to her room, is defiant, and has gone from modest, achievement in school relative to her grades to absolutely all Fs. And again, I don't necessarily attribute all of these things to distance learning because I think people are doing the best that they can, but I think when I hear that we're being shorted on vaccines and our ability for our teachers and for our school districts and for our personnel to get back into the classroom as appropriate and do it safely, and that we have these stories, I'm sure they can be repeated 1,000 times over here by my colleagues and others who would call in. It just makes the point that, again, I am more than willing to sign on any letter to say to the state, we need to get our fair share for the people of this county because people are hurting in a lot of respects. We've had obviously the deaths that have occurred through the pandemic. But when I read these, and again, we're all getting these, they're examples, though, I think of the kind of desperate situation that people are in. And we've, got to do our best to get the vaccines administered, to get the doses that we need to help our people so we can return to school safely and return to more normal life. Because when I read about kids, they're the ones that are going to replace all of us that are here today in this room at some point in time. And if we're losing a generation of young people, and then some of them are losing their lives, and that to me is, it's not acceptable. We need to do what we can as we are. And so I thank again Dr. Kasseri and Dr. Hunt for your work and certainly leadership, Ian and Bruce and all the rest. But I wanted to make these points this morning, not to exaggerate or anything else, but I think to put another exclamation point behind why the data and the statistics in getting fair share of vaccines for this county and this people is so critical. Thanks, Madam Chair, for bearing with me.
Well, that's heartbreaking. Thank you, Supervisor Natoli. Supervisor Cerna.
Thank you. I just want to make mention of the fact that you guys are really good because we just received the FAQ while you were talking from Kim Nava. So.
Like I said, she has got a team. I mean, she has got a team.
Working some magic.
I'm actually posting it right now, so thank you.
Okay. I believe we have no more questions, and we thank you very much for the updates. They're always informative and help us a lot in knowing how to respond to our constituents.
And we do not have any public comments.
We have no public comments?
No.
I'm shocked.
Me too.
Okay, next item, please.
Okay, so your